Are pressure points real? Signs that acupuncture is working. Can acupuncture loosen tight muscles? All right, welcome to our next episode of Acupuncture with Breeze Academy and me, Dr. Carl Clarkson. And what we're going to be doing today, a little bit of a different vibe, and we're kind of going to go along the lines of, well, what are the most commonly asked questions in acupuncture and dry needling? And the reason why I thought that was a good idea this time is we'll get loads of comments on our Facebook group. We get comments off our videos and our podcast episodes. We get clinical queries coming in. We get people asking queries when they're going on to courses or before they're booking onto courses. So there's loads and loads of stuff. And I'm going to just kind of rattle through some of the bigger ones, the more common ones. And then it's up to you to do what you want with it, all right? So first up, can acupuncture loosen tight muscles? So the way I think about this is we have acupuncture and we have dry needling. And I think that if you've heard about people going for a needling session, which is to do with tight muscles and tightness in an area, it's probably more likely that they're going for dry needling rather than acupuncture. And I'll explain that in a second. It's not to say that acupuncture couldn't help with the tight muscles, far from it, but it's more likely that if you are presenting with a feeling of tightness and tension in your muscles, the therapist is probably more likely to go with a dry needling technique. So let us explain. Dry needling is more for muscle tension or muscle knots, referred to sometimes as trigger points, right? And so if you've done your training before, you know what those are, right? But essentially, if you've got some tension or feeling of tension in a muscle belly, we can find that lump or that hard nodule within the soft tissue, and we can put a needle in it. And how we needle it with dry needling is usually fairly vigorous needling approach. And what we're trying to do is trying to force that muscle belly to relax, or that portion of the muscle belly to relax. And what's really good with this is that you can go really vigorous in a really short period of time. 15, 20 seconds, and you can make a difference, a noticeable difference to that feeling of tension, to somebody's range of movement, or maybe their power and their resistance. And I mean, like I say, it can be super, super quick. So why I would be, if somebody was coming to my clinic and saying, right, I feel like I've got a load of tension in the area and I could feel that there was a trigger point in that area, I'm probably more likely to go with a dry needling technique, which is very dramatic, very here in the now, and we bash the hell out of it, right? We're absolutely smashing that trigger point, sorting it right out. However, having said that, when I would be thinking about acupuncture for tension in muscle bellies or the feeling of tension is, well, I guess there's a couple of ways. If I thought that the underlying reason for the tension or the feeling of tension in those muscle bellies was perhaps some anxiety, stress, the feeling a bit overwhelmed, I'm probably more likely to go with acupuncture because the root cause of that feeling of tension is actually to do from the psychosocial elements. And there's a really couple of nice recipes we can do with that, right? So one is we could do auricular, which you know by now I'm a massive fan of. So doing some needling in the ear can help with calming the sympathetic nervous system down so we can chill things right out. And if that's the reason why people are feeling tension in the muscles, fantastic, right? We're dealing with the root cause, and therefore, because people feel more relaxed, they're less likely to feel that they've got tension in the area. The other option that you've got is 4 gates. Again, something I've mentioned on multiple podcasts in the past, but essentially we've got large intestine 4, which we'd use in our hands, and liver 3 in our feet. So it's 2 acupuncture points bilaterally, hence the word 4, and gates are supposed to represent the gateway or the access point to the chi. You've got 2 in your upper limb and 2 in your lower limb, and they're supposed to help combine and flush the chi all over the body if we're going to go TCM respect. From a Western perspective, 4 gates is very much hitting those really super sensitive areas, hands and feet, which are much more likely to get bigger messages to the brain. So if you think of that thing that you did, I'm sure, in your undergraduate education, where you talked about the sensory homunculus, so the areas that are going to give the biggest message to the brain. That's why we're kind of thinking, well, putting needles in hands and feet are more likely to get big messages to the brain, and that's where all the psychosocial stuff's happening, right? So, yes, acupuncture can help tighten muscles, but really it's down to what am I trying to achieve? If it's a specific muscle belly that's just got a trigger point in it, I'm probably more likely to go with dry needling techniques. If I'm going to go for more the root cause of the problem, I'm probably not going to do dry needling. I'm going to do acupuncture, and it's probably going to be something like auricular or foregates. I guess the addition to this, or what I also consider, is if we're talking about tension in the musculoskeletal system without serious pathology, that's what I've just described. But if it's something like, say, a neurological condition, so they might have like high tone, which feels like muscle tension in the area, the approach might be slightly different. I don't think auricular and foregates are necessarily ruled out by any stretch, but I might be more tailored to the problem. So it may be that if it's high tone in, say, the right limb, I would start needling the left limb, and I would use acupuncture points that I would ideally use in this side, but I'd use in the left side to see if I can just calm things down, things to relax out. And I know that neurophysios who are using acupuncture on a regular basis, they'll use this technique because it means that needling the opposite side keeps this side free for them to be able to move the limb around to do some rehab. Because, in the end of the day, the rehab is the part that's going to help improve the symptoms of tone. So I thought I'd just throw that bit in there just in case we're considering muscle tightness as maybe something more neurological. Okay, so segment 2 here, we've got signs that acupuncture is working. So I've split this up into 3 scenarios. We've got the immediate effects. So how do you know as a clinician then and there that this is something that is being effective? I've then split it up into the after effects. So the things that your clients and patients are likely to tell you, after the session, or maybe when they come back in to see you 3, 4, 5 days later. And then we've got the more longer term indicators that acupuncture is working. So the immediate stuff. I think when you're first learning acupuncture, this is the stuff that can really help you go, okay, something's happening here. I don't know if it's positive or not, but something's definitely happening here. And that is those sensations of Dai Chi. So Dai Chi, if you remember the spelling, is D-E-Q-I. Dai Chi means bringing of the Chi. And effectively, it's a word to describe a huge set of sensations. Tingling, warm, ache, spreading. Those are kind of sensations that people might feel in and around the needle or on the arm, or if you want to go down a meridian route, along a meridian. So if you're needling somebody and you're not sure that it's making a difference, or you want to look for some way of figuring out if it's making a difference, go on the subjective stuff. Listen to the Dai Chi sensation. You know that if you've done stuff with us, right, we're big on the whole Dai Chi stuff. You've got to get that Dai Chi sensation going. And that's a really good indicator to you that it's making a difference, okay, or something's happening at least. The Dai Chi sensation can be local to the needle. It could be going up the meridian or down the meridian or on the limb, but it could also feel like central. So you might have had clients where you're putting needles in and they're not necessarily reporting sensations in and around the acupuncture point, but they're reporting sensations here or here. So they'll talk about things like feeling relaxed, feeling chill. Oh, I'm just all floaty, man. Oh, cool, dude. That's your Dai Chi, all right? So if they're having those kind of responses, fantastic. If you've put your needles in, you've left them for 5 minutes and then you come back into the clinic, obviously with a caveat that they've got some way of contacting you, right? But you've come back into the clinic room and they're snoring their head off, right? They're totally Dai Chiing their head off. Like, right, you know that you've hit the spot, right? You are having an impact. You don't know how dramatic that impact's going to be. You don't know how long it's going to be, but you've got something tangible there that will make you say, okay, we're making a difference. So if you're somebody who doesn't routinely look for Dai Chi as part of your practice, I think it can be really difficult to kind of get a flavor of, is this going to work? Is this going to have an interaction? I think the other point to say on this is that although not everybody gets Dai Chi, the vast majority of people will get Dai Chi. So I wouldn't have that as your default. If you're kind of needling away and people aren't getting Dai Chi, don't have it. Oh, well, yeah, just some people don't get it. Very, very, very few people don't get Dai Chi. So bear that in mind. It's probably your technique and it's probably that you're not putting the acupuncture needle in exactly the right spot. So that's your immediate stuff. Straight after the sessions or the after effects, people will talk about, when they come back to see you, they'll say things like, oh, well, look, my pain intensity is less, my range of movement is better. They might talk about, I didn't have as many episodes of pain, so something like migraines. Again, we've done an episode on that in the past that might talk about not have it coming on as frequent. But there are some other clues that you're making a difference, and particularly when you're talking about things like persistent pain or chronic problems that have been going on for ages. Pain as a symptom is perhaps not the best indicator that you're making a difference, certainly in the early days. It's the other stuff that goes and associates with chronic problems and persistent pain. So, for example, sleep. I'll just kind of give a really broad opening question. How were you after last session? And just leave it really open like that. And don't go super specific to begin with. I just say, tell us what you were like after last session. And usually what they're going to be saying here is things like, me sleep was loads better. I felt different in myself. I just felt that. I just felt I was less stressed. Or they might say, I just had a different outlook in life, which sounds mad, right? But they might just say do you know what? I'm just not letting things bother us. And if you've experienced acupuncture, which I'm sure you have if you're watching this, whether as a learner or as a patient, a lot of people talk about that feeling of chill, relax, things not bothering them as much. So I'm listening out for that, right? And I'm kind of asking that really broad question when they come back into clinic. But if I'm not getting anything from them, or they're looking at us going, what the hell are you on about? Then I maybe going to ask some specifics. How was your sleep? How was your mood? How have you been thinking about this problem? Certainly if it's a chronic problem, you're kind of trying to get a feel of how it's impacting on that psychosocial element, because those are the things that are more likely to change first in the chronic and the persistent problems. They may also talk about changes to appetite or changes to toileting habits. So in the immediacy, even though we're not talking about trying to change their appetite or trying to change their toileting habits, those can sometimes be the indicators that you are doing something and that you're making a change. And really common. I would say the most common kind of after effects that aren't pain related to acupuncture are about sleep and are about feel good. They just feel loads better in themselves. They feel relaxed and chill. And if I'm honest, I think that's one of the big reasons why people keep on coming back for acupuncture. You're effectively giving them some kind of drug. Okay, so the long-term indicators. These are probably the easiest ones to pick up on because in effect, that's the symptoms that they're coming to see you for. So if it's pain, they may talk about reduced pain intensity, reduced pain duration. They may talk about the type of pain. So it may previously been a really unbearable, sharp type sensation, and now it's kind of retreated into a dull ache. Or one of the things that you might get are people talking about the location of where the pain is. So they might be saying, well, when I first came to see you, my pain was here. Couldn't tell you exactly where it was, and now it's here. That's a really good sign, because what we're talking about here is a reduction of central sensitization. In central sensitization, non-injured tissue behaves as if it's injured. And that's a classic sign of a chronic problem or a persistent pain problem, where non-injured tissue behaves as if it's injured, i.e. it gives you pain. So if we are to reduce central sensitization, people don't report pain here, they report pain here. So if it becomes a lot more localized, that's a really good sign. I think the other long-term indicators, and I think, we're kind of stepping away, perhaps you've never done acupuncture dry needling before and you're just here just for the, see this beautiful face, all right? And you're like, well, how else could I look at this to think about, is acupuncture making a difference? We've got loads of research out there. We've got randomized controlled trials, double-blinded randomized controlled trials. We've got systematic review with meta-analysis that have said, look, in the long term, acupuncture is making a difference. To my knowledge, and perhaps there's other papers out there that have done this for longer, but there was one study done kind of mid-ish 2000s, which looked at outcomes up to 2 years of having a bout and sessions of acupuncture. And they found that people who had acupuncture were still statistically significantly better than the group who didn't have acupuncture. So that's another kind of a sign, if you like, that acupuncture is working. Although you're not going to rely on that in your clinic, right? You're not going to just pull out a paper and say, oh, well, there you go, proves it. You're more likely to go off the Dai Chi and the things that people are telling you. All right, so next one up, are pressure points real? So pressure points originate from Chinese medicine, and Chinese medicine is based on this concept of meridians. And meridians are the channel in which our energy or qi flows in. If we just don't talk about acupuncture for a minute, right? And we look at more broadly activities that go on within Chinese medicine, we talk about things like exercise and activity. So in a lot of martial arts, they will target specific areas because specific areas have a certain impact when they are struck. All right. You strike with the yang parts of your body. Okay. So this bit, which is yang is supposed to be hard, and you aim for yin parts of the body, which is the softer interior. So in terms of, if we're talking just about martial arts, and I'm no martial arts expert, right? But if you look at where people tend to strike in Chinese medicine, those points which are kind of thought of as weak points or points that you want to hit somebody in, they are acupuncture points. And so in martial arts terms, they might be referred to as pressure points. If you do acupuncture, you might say, oh, look, that's a stomach 9, or you might look at it and say, yeah, that's a lung 5 or something like that, right? You look at it and say, oh, yeah, well, that's an acupuncture point around there. So broadly speaking, pressure points do exist because they are areas that martial artists will target when they're competing in combat. Then we go to the kind of the more health-related stuff. So in the health-related stuff, pressure points are effectively acupuncture points. And they're where you don't put needles per se, but you could use digital pressure. So you could use a thumb, you could use an elbow, you could use a pisiform or a scaphoid. You could use your chin if you want, right? It doesn't really matter. But in effect, what it is about looking for an acupuncture point and you apply firm pressure. There are a couple of bits of research that look at this. Probably the most frequently quoted is pericardium 6. And this is kind of the most famous one as well, because pericardium 6, which is just here on your wrist over this area here, that's for nausea and vomiting. There are a couple of papers that you can find. If you go to the Cochrane Library, Cochrane is spelled Cochrane. You go to the Cochrane Library and you search for either PC6 or you search for acupressure. You will find papers that have looked at the impact of acupressure over pericardium 6 for things like nausea and vomiting. They tend to be focused on chemotherapy-induced nausea and vomiting, but can be applied to lots and lots of other things. So pericardium 6 is a real good classical one, I guess, to think about as a pressure point. There are other pressure points, which are in effect are just acupuncture points. We have an acupressure guide for free. So if you do want our acupressure guide for free, you just get in touch with us and we can send that onto your via email. So that's a few things you can have a look at there. In terms of what they are, so this kind of like falls into the realm of, well, what is an acupuncture point? Because obviously pressure points are acupuncture points, right? Now, I'm going to give you a really brief history of this. In Western medicine, meridians don't exist. So meridians and this idea that chi and energy flows through your meridians is not something that in Western medicine we kind of buy into, right? But you've got people sticking needles in specific areas around the body, and it seems to be making a difference, right? So for decades, there's been an attempt to go, well, we're observing these impacts and these benefits. We've got the only real theory you have is traditional Chinese medicine and about meridians and acupuncture points. And we don't have an anatomical thing about what these are, but we have a clinical picture of somebody having an effect. So there's a few things that over the years people have stipulated or suggested may be what meridians are. So it started off, if I remember, about nerves. So there was a suggestion that, well, actually, maybe what the Chinese were talking about thousands of years ago were the nerve pathways, and that acupuncture points are close to or over a big nerve or a big nerve bundle. The problem with that was that it's wholly inconsistent. So yes, there are some acupuncture points that inevitably go close to or right next to a nerve, but there are many, 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 many more acupuncture points that don't really go anywhere near a nerve or nerve bundles. So there wasn't that consistency there. Yes, there's going to be some overlap, but it's kind of like just saying, well, you know, there might be a blood vessel over the area. The next thing that kind of caught a bit of traction was around the lymphatic system. So there was a suggestion that perhaps acupuncture points, or in this case, pressure points, were located to areas of the lymph system that, again, were a bit more concentrated. And that was fairly quickly debunked as an idea because similar to the nerve stuff, maybe there was a handful of them that were close to lymph nodes and lymph bundles, but nothing really that kind of like made it any consistent. There was an idea about trigger points. So again, there are some acupuncture points that are over very prominent trigger point areas. So gallbladder 21 is a really good example of that. So you get like hard knots in your gallbladder, in your upper traps, and that's related to gallbladder 21. But again, too inconsistent, not consistent enough. Given that, we've got something crazy like, I don't know, like 400, 500 acupuncture points in the body. So it just kind of doesn't match up. And then we had some work in the 90s and then going into the early 2000s, which probably, for me, does match up. And this is where we talk about fascia and connective tissue. So just before I get into this, fascia and connective tissue is something that is very seriously researched and looked at now. You probably didn't do much, if any, of this in your undergraduate education. It's kind of brushed over, and I'll hold my hands up, right? I used to teach anatomy on physiotherapy degrees. It's not something that we cover. We talk about muscles and tendons and ligaments and cartilage and stuff like that, but fascia and connective tissue kind of gets pushed to the side. But there is a growing body of researchers that are looking very intently at fascia and connective tissue now. Okay, but we'll put that aside now. How does this relate to acupuncture? Well, there was a famous book that was published in the 90s by Thomas Myers, and he effectively said, we've got these things called fascial trains, which connect muscle bellies and tendons and ligaments and all the soft tissues. It connects all this stuff together, right? It's not like here's a muscle belly, the beginning and the end of it, and that's it. This muscle belly has got interconnections with the other muscle bellies and the other ligaments and all the other soft tissues. And one of his things that he had in his book was this idea that when you dissect a body, there are certain planes or trains, he called them myofascial trains. And this is what this lateral train looked like, or this is what the superficial backline looked like. And this is where it got pretty intriguing, because you have an anatomist, so somebody who dissects bodies for a living, right? Saying, hey, look, this is the thing that we see on the dissection table, this is this thing. And then acupuncturists are looking at this and say, well, that looks like a bladder meridian, or that looks like a gallbladder meridian, or a spleen meridian, or whatever it is, right? And there seem to be some fairly consistent presentations of fascial trains and connective tissue and what we consider the traditional acupuncture meridian stuff. And that's probably not a massive surprise when we think about it logically, because in traditional Chinese medicine, the idea of the meridians is that they are connecting all of the tissues and the different parts of the body together. So this idea that connective tissue in fascia is actually potentially a meridian, that kind of sort of makes sense, right? And then we have some, I guess what I'd say, some seminal papers that were done in the early 2000s by Helena Langevin. And what she did was she looked at, right, what are acupuncture points? Like, what is it? What is these things that we're putting needles into? They seem to be reacting when we put a needle in. So you'll have felt this, right? You'll be needling an acupuncture point. It feels like it grips or it tightens up. What is it? It doesn't seem to be the muscle belly, because it's not like as if the muscle belly is going into spasm. And in a series of papers, what she found was there seemed to be a relationship between when we're putting a needle into an acupuncture point, there seemed to be a concentrated bundle of fascia in this area. So when you put a needle in, the fascia and the connective tissue interacted with the needle and wrapped itself around the needle. As far to go and saying that you could predict when somebody's going to report that Tai Chi sensation by when that fascia and connective tissue wrapped around the needle. And that is why when we're looking for Tai Chi, we rotate the needle backwards and forwards, because we're trying to get that fascia to kind of wind itself up and around the needle. The second part of this was that she looked at scenarios where she went, well, what are acupuncture points, and can we map out acupuncture points compared to fascial bundles? And the upshot of this was to say, well, it seems to be that I think it was something in the region of 80% of the acupuncture points they looked at were also strongly related to concentrated areas of fascia. So this was kind of like probably the one that stood the longest test of time, if you like, of saying, well, it does seem that these pressure points or acupuncture points do have a physical entity. They are something. They're not just kind of like a theoretical concept from thousands of years ago. There is actually like an anatomical structure to these acupuncture points or acupressure points or pressure points, whatever you want to call them. So I think, although that's a fairly long way of describing it, I think we do have some evidence base to suggest that acupressure points and acupuncture points do exist. And I think the final bit that I'd put in there from an evidence-based perspective is some of the work that Vitaly Napadao has done and some of his colleagues around, well, what happens when you needle an acupuncture point versus a non-acupuncture point. So they'll select a dermatome, so an area that's innervated by the same nerve root, and they will put needles in. They'll put one needle in a non-acupuncture point, and they'll put another needle in an acupuncture point. And what seems to happen is when you needle a non-acupuncture point, you get a response. That's what you'd expect, right? You're introducing something into the tissue. You would expect your brain to recognize that. So scan a functional MRI scan and something lights up in the brain. But when you needle an acupuncture point, there seems to be a different reaction. So it's in the same dermatome, remember? So exactly the same kind of nerve root and going into the dorsal horn and what have you. But there is a difference in terms of what areas light up in the brain and to what magnitude. So I guess for me, that's kind of another example of why it's important and what these do exist. If you're looking for a more simplistic, do acupressure points or do pressure points exist? A really simplistic way to say that is you put a needle in or you do acupressure over an acupressure point, over an acupuncture point, and people will talk about dai chi. They will talk about achiness. And if you do that compared to a non-acupuncture point, you will find it's a lot more dramatic at these pressure points or these acupuncture points. All right. So if you are doing acupuncture or acupressure, what's the time frame? Acupressure is fairly straightforward, right? Acupressure is normally you hold it until the symptoms fade off. So if you were doing, say, nausea and vomiting, you would hold that acupuncture point in there until that nausea fades. There's no set timeline on this. It's more about just keeping the pressure on there until the symptoms fade. If it was something like anxiety or feeling stressed, doing something over your ear and just rubbing your ear until you just feel better in yourself. Okay, so there's no set timeline on that. If you were kind of wanting to put a number on it, you're probably looking at somewhere in the region of like 30 seconds to a minute. If you were the therapist delivering this, I'd maybe hold that pressure on there, then I would go into some kind of like effleurage techniques. But yeah, really the acupressure is about, if you can teach your client to do this or your patient to do these, that's where the magic is, right? Not about you applying the acupressure. It's about teaching your client or your patient to apply the acupressure. That's when you're going to get the benefits, because then they can do stuff outside of your clinic, all right? It's effectively like a home exercise plan. If you can give your client some acupressure points that they can do to help manage their symptoms in between sessions seeing you, fantastic. In terms of needling, tend to say around about 15 minutes minimum. For an acute, subacute problem, you're going to go for about 20, 25 minutes. For a chronic problem, you're going to try to go up to about 40 minutes. Your dosage, the longer that you leave needles in, the stronger the dose is going to be. All right. So it looks like kind of my take on this is that after about 40, 45 minutes, you're not really getting any more benefit, and that benefit will plateau. So is there any need to keep the needles in any longer than that? I'm not so sure. What I would put in as a caveat on this is that we don't have any strong comparator evidence here. So we don't have, a paper that said, well, what's it like 15 minutes versus 20 minutes, or 15 minutes versus 30 minutes, or 15 minutes versus 40 minutes. We don't really have that. There were a few papers done maybe 15, 20 years ago trying to look at dose, but the focus now seems to be more on a pragmatic trial, i.e. do people tend to be better off having acupuncture versus not? I would say most protocols you see in the research tend to be kind of in that 20 to 30 minute mark. And that kind of replicates or trying to replicate day-to-day practice, where I would say most clinicians are kind of going for that kind of time frame. So my last thing I'm going to say about acupuncture points, or the last question I had here, is about what's my favorite acupuncture point, which always kind of makes us think, right, do I have a favorite? Do I have you're not supposed to say it, right? With your children, right? Like, you're not supposed to have a favorite, even though everybody does have a favorite. So I think my favorite go-to would probably be stomach 36. So stomach 36, which is one sun lateral to your tibial tuberosity. It's just got these super duper massive claims to it. It does pretty much everything. If you look in a textbook, so one of the textbooks that we've got is this big, thick orange textbook like this, right? And it's like 4 pages dedicated to describing what this acupuncture point does. And it does all sorts of symptoms about general well-being and health. But I think why I'm drawn to it is that I'm a fan of exercise. I like the idea of sporting performance, quite interested and intrigued about that. And stomach 36 gets used a lot in elite sport and sporting performance, trying to help with fatigue, trying to help people manage their workload, if you like, leading up to a competition. So if I was going to say what's the best acupuncture point in the body, it would be stomach 36. So I hope you've enjoyed that episode. I would love your feedback as usual. And I know I say this every single time, but genuinely, this makes a massive difference. Please like, comment, share on this episode, right? Go and watch the other episodes, and hopefully you find those interesting, right? But that's the thing that helps drive us and know that we're making a difference. We're helping you. We're giving you stuff that you find enjoyable or helpful. It may be for you. It may be to send your clients and your patients to this as a resource. But without you like, commenting, and sharing, we don't really know if we're doing the right thing. I mean, we've got an idea, right? But like those kind of things make a massive difference. So if you could do that, I would be eternally grateful. Okay, see you next time.